Back to this video series where we are looking at the United Nations High-Level Meeting 2025 on non-communicable diseases and the advocacy priority areas that the Non-Communicable Diseases Alliance globally, in collaboration with the global NCD community, have put together to be presented at the United Nations High-Level Meeting, potentially to be adopted by the governments and heads of state who will be meeting to decide what the ecosystem will look like in as far as non-communicable diseases are concerned from 2025 and beyond. My name is Ogweno Stephen. Let's roll. The third key advocacy priority area that the Non-Communicable Diseases Alliance, in collaboration with the global NCD community, are presenting at the 4th United Nations High-Level Meeting is mobilizing investment for NCDs. In this priority area, we are asking for a provision of sufficient and sustainable financing to meet the disease burden in the various communities. We know that many countries, especially low and middle income countries, rely on developmental funding for health. And when this funding comes in the national plans that have been developed, we have seen that non-communicable diseases do not receive sufficient budgets for the disease burden that they present in the various countries. And so even as governments try to find efficient and cost-effective ways of implementing the national health plans, we often see that non-communicable diseases are often left behind with very minimal budgets that do not meet the huge disease burden that non-communicable diseases present in these countries. Therefore, the Non-Communicable Diseases Alliance is reminding the governments that the most efficient and cost-effective way to address the burden of non-communicable diseases is to channel funding to address NCDs prevention and care. The cost of preventing NCDs and the cost of managing NCDs is far much greater than the cost of inaction. For every dollar invested, $7 is reaped in return when it comes to addressing non-communicable diseases. And this is a key message that the non-communicable diseases is trying to put across for governments to really mobilize investments for non-communicable diseases. Some of the key advocacy asks under this key tenet include the following: commit to a set of global funding targets for NCDs as set from different reports, including the second financing dialogue for sustainable financing for NCDs and the WHO reports. This is to ensure that globally there is a set target that all key actors across are working towards ensuring that the target is met, to ensure that these suggestions that were provided in these documents and these think tanks are implemented and we're able to reap the benefits of those implementations. The second key ask is really focusing on increasing and optimizing domestic budgetary allocations for national health plans when it comes to non-communicable diseases. This, coupled with a commitment to social and financial protection, especially when it comes to NCDs, will ensure that we are able to achieve universal health coverage much faster, but that we're also able to reduce the out-of-pocket expenditure that is often seen by individuals living with NCDs when we seek services in the various healthcare systems. The next way to really raise these funds and mobilize financing for NCDs is to exercise fiscal policies on tobacco, alcohol, unhealthy diets, and fossil fuels to ensure that taxation is being collected from these actions that we know have a negative impact on health, and that this fund is channeled to ensuring that we're able to address the burden of non-communicable diseases caused by these very actions, but also to ensure that we're able to prevent the increase of non-communicable diseases as a result of these very actions. Finally, we are asking the World Bank and the World Health Organization to provide recommendations and technical assistance for governments to establish policies to ensure that we're able to achieve all the above that have been mentioned. These organizations have the skills, the expertise, and the authority to be able to really provide these recommendations, and we are looking up to them to ensure that these fiscal policies are developed and to ensure that we have integrated financing and that we've been able to mobilize more financing and investments to address NCDs, care, control, and prevention. This is the third key advocacy area that the NCD Alliance, in collaboration with the global NCD community, is asking of the gathering at the United Nations High-Level Meeting 2025. My name is Ogweno Stephen, and see you on the next one.